lovely people, good day. How are you doing? If you are new here, please kindly hit on the subscribe button, and then after that you hit on the notification button so that if you have a new video, you'll be able to have access to them. Today we are going to look at some problem associated with what? With the newborn, especially a condition called esophageal atresia or tracheoesophageal fistula. This condition is very worrying, especially when there is a developmental problem. When this particular condition occurs, it's very serious. There's a lot of psychological management, psychological problem associated with it. Because of that, we are going to look at how the condition manifests, and then we know what we'll be able to do. And each surgical intervention is very important. Thank you very much once again for having me on my YouTube channel. Today we are going to look at esophageal atresia. This condition normally manifests when the esophagus terminates before it reaches the stomach. This condition is very critical. Now, you know that when it comes to the esophagus, it's just like a pipe that connects from the mouth into the stomach. So in a situation whereby this particular pipe that connects from the mouth into the stomach does not reach the stomach itself, and then it forms a pouch around it. It forms a pouch that terminates at a pouch, it becomes a very critical problem. This particular condition means that the patient will not be able to feed, and then the stomach will not be able to get adequate food that will intend to move through the intestines for absorption to take place. It is very critical. Now, when it comes to the esophageal tracheoesophageal fistula, it is when this particular condition, you know that the esophagus is supposed to terminate into the stomach, so that all food ingested will be able to have a smooth channel into the stomach and also through the intestines. Now, if in case there is a particular problem called esophageal atresia, and then this particular esophagus rather connects into the trachea instead of connecting into the stomach, it becomes a very serious problem. It means that there's going to be a fistula or a hole, a connection between the esophagus and the trachea, and then it means that anything ingested is going to enter into the airway or the lungs and causes a very serious problem called respiratory distress. Now, so let's look at what happened when you have a condition like this. It means anything taken orally will be able to enter into the lungs. This is very serious, and then we are going to have a condition called aspiratory pneumonia. Aspiratory pneumonia is one of the problems that is very critical as far as NCLEX is concerned. So please, let's digest this and look at how we'll be able to manage the patient. Now let's look at assessment finding. Imagine any food that you ingest, get into the trachea and then move into the lungs. It becomes a very critical problem. Why? Because the food was supposed to move through the esophagus into the stomach for other digestion to take place. Here's the case: it is not terminating into the stomach, and then it's rather moving into the trachea. That also intends to get into the lungs. It becomes a very serious problem. We try to prevent this by doing some kind of surgical intervention and also putting the patient on NCLEX. Immediately we see that, especially newborn. You'll be able to know this thing immediately the newborn start feeding. It becomes a very critical problem because the esophagus does not terminate into the stomach for food digested, be able to have its normal route. Let's see what normally happens after this condition occurs. So we have the 3 C's. The 3 C's mean when you ingest the food and the food find its way, or after the child breastfeed, the food finds its way into the trachea and the lungs. It means that the child is going to cough. It's going to be a very serious, severe cough, and then choking. Why? Because the food is going to block the airway, so it will choke the child or the infant, which is very critical. So the cough is going to be there, the choking is going to be there, and then unexplained cyanosis. Please take notice of this. This is one of the NCLEX areas that they normally set questions on. There's going to be unexplained cyanosis. Why? Because food has entered into the stomach, into the trachea, and it is blocking the airway. The system is not getting adequate oxygen. Because of that, the child will become bluish discoloration, which is very dangerous. And then there is going to be a frothy saliva, because the child is supposed to swallow anything that comes in. And then here's the case, anything digested, okay, any intake ingested is not going, so the child will try to bring it out. Sometimes it's saliva that is coming from the mouth and the child will be drooling, and sometimes there's going to be floaty. The saliva is going to look like a floaty, saliva, and then the child will drool. It's very, very serious. And then vomiting is also associated with this particular condition. And then take note, in as much as the lungs, okay, in as much as it terminates into the lungs and then some of them find its way into the stomach, the abdomen will become bloated due to air. No air that is getting into the lungs will find its way into the stomach to cause abdominal distension. It is also very uncomfortable to children. So the child will be crying severely because the child needs help at this moment. This is very critical. And then there's going to be increase in respiratory distress. Restlessness is also going to happen because there is airway blockage, or food has been entered into the airway, causing aspiration pneumonia, which is very critical. So respiratory distress is very, very common in this condition. How do we manage esophageal atresia and then tracheoesophageal fistula? How do we manage it? Now, we have to try as much as possible to give oxygen, because the child, remember, in the symptoms or the assessment finding, we said the child will look bluish. So bluish discoloration is going to happen, and then the child is going to is going to have cyanosis, which is very, very dangerous. So we give a lot of oxygen to the child, and then you suction the child. Remember, drooling is going to take place, and you need to suction to clear the airway so that the child can have adequate oxygenation. And then you put the child on NCLEX. You don't put anything by mouth. If the child is breastfeeding and the problem occurs, immediately you stop the breastfeeding and then you try to suction to give oxygen to the child, and then you put the child on NCLEX. It is very, very important. And then you have to resuscitate the child and also give a lot of fluid. Fluid is very, very important in this particular condition, and you have to warm the child. It's a newborn, and the child, the first meal that the child gave him a very serious problem. Because of that, we need to try to give the child oxygen and warm the child, okay, so that adequate temperature will be maintained. Then we have to also try to maintain the child in a supine position, and then about 30 degrees, okay, about 30 degrees. It's also very important to put the child into that, okay, about 30 degrees. So you have to raise the head of the bed, which is very, very important. So that is what we are talking about. And then you position the child such a way that the child can drain, okay? The child can drain and also prevent aspiration, because there's going to be a drooling. Because of that, when you position that child, okay, the drooling or the saliva or whatever is coming from the child's mouth will be able to come out. It is very, very important to do this. Now, NCLEX love these areas a lot. Because of that, please take note. Choking, coughing, and then unexplained cyanosis is very critical. You put the child on NCLEX. Why? Because there is a problem happening. That is why we are doing NCLEX target. Okay, now after the operation, we are going to do we are going to anastomose. You understand? We are going to anastomose this esophagus into the stomach, so that at least anything ingested can get or find its way into the stomach. So we are going to do anastomosis. Then right after the operation, okay, we have to check vital signs. And then you need to give or maintain IV fluid. It is very, very important to do that. Then you assess the child for any sort of respiratory distress. Any sort of respiratory distress is very critical, and then you monitor the intake and output. Also monitor for pain and monitor gastrostomy tube. Sometimes there's a gastrostomy tube that is in place, to be able to facilitate the healing, okay, so that the child will not ingest anything through the mouth, through the esophagus. So there's going to be tube so that drainage and stuff can happen, so that at least wound healing can be promoted. Okay, and then we say that you raise the gastrostomy tube when the child is feeding. It is very important to do that. And then you give the child a pacifier. Now, there are some critical things here when it comes to NCLEX. Okay, now, when the child cannot maintain secretions, we don't give pacifier, because the child needs to swallow. Because if the child tries to swallow and it is not happening, that child is going to aspirate or get choked with the saliva. So take note, okay, when there is drooling, which the child cannot contain, or fluid or saliva the child cannot contain, don't give pacifier. rather give the child, put the child on us. But if the child can also maintain the secretion, then you can give the child a pacifier. The pacifier will help the child to stop crying and also make the child comfortable. You know, when children are crying, you know, those things that they put in their mouth to be able to for the child to suck on. All these things are a way of managing the child. So take note of these two, because you are likely to have questions on them. When you see it, you don't panic. Okay, take note of that. And then you teach parents the need to suction the gastrostomy too, because sometimes there may be what we call aspiration. There might be sign of maybe aspiration, and then if you teach the child or the mother, okay, how to suction this particular tube, it will help him or her. It is, or the child. It is very critical point to take notice of. And then you check of any sign of respiratory distress, any sign of poor feeding, any sign of dysphagia, and also drooling, so that you'll be able to manage the child accordingly. Ladies and gentlemen, thank you once again. If you want us to get you into the content, okay, you contact us, or you put it on the comment section, so that we can link up. We have thank you very much.